Tonight, it's official. The province is moving into a shutdown.
If we don't do it, we'd be in deep, deep trouble.
What you can and can't do beginning Saturday, and why some doctors say the restrictions don't address one of the most pressing concerns. And
I rented a trailer last week, filled it up with all the equipment. I wanted to just go around to different parks.
gyms will now have to revert back to giving virtual classes only. We'll have reaction and the one exception. Plus,
I encourage every resident who is eligible to get vaccinated and to do it this Easter weekend if you can.
and the age of eligibility is being lowered at mass vaccination sites and pharmacies across the GTA. But why some experts worry some of those most at risk are being left behind. Good evening, I'm Kelda Yoon. Ontario's Premier has made it official. In just over 24 hours, the entire province will be moved into what's being called an emergency brake shutdown. This comes as ICU numbers in Ontario hit record highs this week, with patients younger and sicker than ever before. The restrictions are aimed at curbing this explosive spread, but as our Chris Glover reports, some medical experts say they don't address one of the most important concerns.
Patios in Toronto and Peel reopened less than 2 weeks ago, and now they have to close again.
It didn't work the first time. It didn't work the second time. What makes you think it's going to work the third time?
This restaurant owner says he spent tens of thousands of dollars to reopen.
It kills me to cut off the outdoor dining.
The Premier says he had no choice but the 4-week province-wide shutdown starting Saturday.
If we don't do it, we'd be in deep, deep trouble.
The health minister says it's different from the stay-at-home order just after Christmas.
We saw that last time that it had tremendous ill effect on both children and adults, and especially with the warmer weather coming, we want people to be able to go outside and enjoy the outdoors.
Last week, personal services in lockdown zones got the signal to prepare to reopen on April 12th.
I booked about 3-4 people a day, and I was already going into my 3rd week.
Mississauga hairstylist Jessie Resendez feels gutted.
I just feel like, we're just not getting treated fairly.
For Toronto and Peel, most everything else remains the same. The province-wide approach is meant to discourage travel.
People from the high areas of lockdown are going out to the other areas, and we're seeing that spread.
The true story is it's much more complex than that.
Dr. Zane Chagla contributed to data in Ontario's latest modeling report showing essential workers saw the highest rate of this latest variant-fueled surge.
This buys us time. It helps the healthcare system great. But if we're not dealing with that route of transmission, no matter if we're open or closed, that's going to continue.
And probably get worse, he says, since essential workers will have to keep working during shutdown. He would prefer paid sick leave and targeted vaccines for those who can't stay home.
It is shameful that at this stage we're using blanket lockdowns as really the only public health measure.
The Canadian Federation of Independent Business points out in Toronto and Peel, indoor dining has been closed for 300 days now.
But for goodness sakes, we've got to find a pathway to allow businesses to have a heartbeat of economic activity if we're going to have a hope of having jobs for Ontarians to come back to.
And if I were running my business the way they are running their business, I would be out of business.
The CFIB says that on average, Canadian small businesses have taken on $170,000 worth of pandemic-related debt. And the president was telling me that 1 in 6 small businesses are not expected to last through the pandemic. And that analysis was done prior to this latest Ontario-wide shutdown. So his fear is that things could get even worse. Chris Glover, CBC News, Toronto.
The shutdown means gyms will also not be allowed to operate. And it was just this past Monday that outdoor exercise classes were allowed again in Toronto with a maximum of 10 people. Our Dahlia Ashry is in Roncesvalles at a spot where a fitness class was held earlier. And Dahlia, those who were there obviously very disappointed in today's news.
That's right, Kelda. I know this parking lot is empty right now, but earlier today, like you said, there was a fitness class that was being held out here following the restrictions that have been in order since last week. There was about 5 people here, including the instructor. So I went around asking them how they feel about the announcement today of the province heading into a shutdown on Saturday. One person told me they don't think it's fair that people can still go outside and play golf, and while he comes out here and likes to exercise, he won't be able to do that again starting on Saturday. Another person I spoke to, who's a doctor who works at COVID wards, tells me she's been coming out here because she couldn't go to the gym, and that's been helping with her mental health.
I couldn't go to work every day and be a doctor without exercise. And it's really hard to do it at home.
Pushing through and squeezing in one last workout with others before the new restrictions kick in, including
prohibiting personal care services and personal fitness services.
Jeff, you're going to be right here.
Greg Hetherington owns a gym. He managed to run a few classes earlier this week after the province relaxed restrictions, allowing for classes of up to 10 people outdoors.
We rented a trailer last week, filled it up with all the equipment. Wanted to just go around to different parks and see if we could make it more accessible for different people throughout the city.
But now it's back to just virtual fitness classes. And while that's better than nothing, Dr. Catherine Sabiston, a mental health and physical activity expert, says there are health benefits to being outdoors and exercising with others.
Having a place to go to be active, knowing our environment, our programs that we're engaging in terms of exercise, and this lockdown then removes that sense of a structure.
Now, there are exceptions for some fitness facilities during the shutdown that begins on Saturday. Gyms that provide physical therapy services can remain open. Ryan O'Connor is a Toronto lawyer. He says people in the fitness industry have contacted him to find out how they meet the requirements.
And I'm assisting gyms with ensuring that they strictly comply with the disabilities exemption if they're serving individuals in the disabilities community and wish to remain open with the shutdown order in place.
O'Connor says people who identify with having a disability can access these physical therapy services at gyms if they provide proof from a doctor that they do indeed need that physical therapy. Now, we don't still know what exactly that entails when it says physical therapy, so we contacted the Ontario Ministry of Health and they didn't get back to us in time for a broadcast. Kelda?
Thanks so much, Dahlia. That's our Dahlia Ashley reporting live for us tonight. Something that isn't closing for now is schools. The province says keeping kids in class is a top priority for the government, but there's skepticism among parents around how long schools will be open.
I don't know. It's a great question. I really don't know.
I'm trying to stay positive because it's too upsetting to really think about what the possibilities are.
Kids will return to the classroom on Tuesday after the Easter long weekend, and the plan is for them to return after spring break. The education minister spoke today about the logic behind that decision.
The students deserve to be in class, and on the advice of the Chief Medical Officer of Health, Ontario schools will remain open in this province. April break will proceed for students' mental health and their development and for their learning.
Parents who rallied outside Queen's Park today say they're holding the minister to that. Though nothing is set in stone, the province is taking it day by day. And Doug Ford says he won't hesitate to act if case counts rise. The month of April could see nearly 800 Ontarians end up in the intensive care unit with COVID-19. That's according to the latest modeling from the Science Advisory Table. As our Jessica Ng reports, it's a scenario that could impact everyone's access to hospital care.
According to today's projections from Ontario's COVID-19 Science Advisory Table, the situation in intensive care units across the province is dire and about to get a lot worse. COVID-19 related emergency room admissions are at 430 as a result of a recent almost 42% increase in hospitalizations related to the virus. That's because, according to Adelstein Brown, co-chair of the Science Advisory Group, this wave is being aggressively driven by the spread of variants.
It's spreading far more quickly than it was before, and we cannot vaccinate quickly enough to break this third wave.
Their data says the UK B117 variant carries a 1.5 times elevated risk of death and double the chance of ICU admission.
COVID is killing faster and younger.
Brown says right now, emergency rooms have a larger proportion of young Ontarians than at any other point in the pandemic. In December, 30% of COVID-19 patients in emergency care were younger than 60. Now that number is close to half, putting a huge strain on hospitals in the province.
We already have very full ICUs, very full hospitals, and we know that the impact of the current surge that we're seeing is not going to be felt in the hospitals for another 2 to 3 weeks.
The modeling shows COVID-19 related emergency room admissions are projected to move to 800 in just a few weeks.
800 is a place where we are not able to provide all of the care as well as we would want to people.
Drastically impacting access to care for all patients. Surgical backlog was already at a pandemic high of over 245,000 near the end of March. If spread continues to follow experts' projections,
You start having to decide who gets ICU and care and who doesn't. And when we see more and more young people, can you imagine having to make that decision?
Jessica Ng, CBC News, Toronto.
The age of those eligible for a vaccine shot is being lowered at mass vaccination sites in the GTA and at pharmacies across the province. But experts say some people who are most at risk still aren't getting a vaccine. Lorenda Redekop has more.
Starting tomorrow, people 60 and up can book an appointment at a mass vaccination site in both Toronto and Peel. That's down from 65.
I encourage every resident who is eligible to get vaccinated and to do it this Easter weekend if you can.
The government also expanded the pharmacy vaccinations beyond the pilot project in 3 cities, adding close to 400 across the province and expanding the age of eligibility to anyone 55 and up. Here's a look at where the new Toronto locations are, in addition to the original sites from the pilot, plus new locations in hard-hit Peel region and the rest of the GTA.
We provided to the province a list of pharmacies because their list was short on pharmacies that were in some of the hardest hit areas. We gave them a list, and to give them their due, a number of those were added.
He says making it easier for people in those communities works, like this clinic today at a mosque in northwest Toronto. A couple hundred people got their vaccine at a mobile clinic run by Humber River Hospital.
More than relief. I felt like if probably I won $1 million.
But leaders here say not everyone feels that way, and talking one-on-one helps.
To address the needs of families, whether they be hesitancy or otherwise, that's the only way we can get more people vaccinated.
That's as modeling today showed so far, people in neighborhoods like this one aren't keeping up with other areas for vaccinations. They showed the hardest hit communities on the left have fewer people vaccinated than the safest communities for COVID on the right, across most age categories.
It's really a ground game right now. You need to use innovative techniques. You need to support people in getting out to the vaccines. You need to make sure that it gets where it's going to have the biggest impact.
He says mobile clinics are one of those techniques. People running them hope to expand.
One of our worries at the moment is that the big centers have capacity, but people are not booking the appointments. But we feel that when we come to these small pop-out communities, we have a better engagement.
Toronto Public Health says vaccinations will start to focus on people 50 and up in hotspot neighborhoods, people at a higher risk of illness or death from COVID-19. Lorenda Redekop, CBC News, Toronto.
And he got a pitch over the heart of the plate, and he crushed it.
A sure sign of spring, the Jays are back in action, kicking things off with a win against the Yankees. We'll hear more from fans on what it's like to watch their team from afar after the break. Plus,
with clear skies ahead, we do have a cold night on our hands. I'm meteorologist Colette Kennedy. We'll take a look at those temperatures, but also the warming trend coming for the holiday weekend.
Welcome back. An exciting day for Toronto baseball fans. It's opening day for the Blue Jays. They beat the Yankees in New York, and 10,000 fans were there to see it. As Greg Ross reports, fans here hope to see the team in person this season, too.
Blue Jays fan David Haggerty has high hopes for this season, but he wasn't quite feeling the energy in the city today, watching the game on this patio not far from the Rogers Centre.
This is absolutely not how I expected to start this season, in an empty tent, watching them play with no one here.
And he got a pitch over the heart of the...
And it's likely going to be quite some time before fans like Haggerty will see the team in person, with the Jays being forced to play home games south of the border for the second straight season.
This is 2 years in a row. It's tough to watch them not play in Toronto.
Would love to go watch them in person, but we're not going down to Florida anytime soon. So.
Instead of playing home games here at the Rogers Centre this season, the Jays are going to start from their spring training facility in Dunedin, Florida. But the team is not ruling out the possibility of being back here for at least part of the season.
I think we'll all be watching the same things. It's going to be clear to all of us whether the circumstances, present a meaningful and healthy case for us to get back home. That's where we want to be. We hope to get there.
That was Jays president and CEO Mark Shapiro in February. He says they'll be following COVID-19 case counts and watching the vaccine rollout closely. But ultimately, the Jays need permission from the federal government to play at home. In a statement today, a spokesperson from Health Canada told us repeated cross-border travel of Canadian and opponent teams and spectator gatherings remain some of the key areas of federal, provincial, territorial concern for a full return to play of professional sports. But they didn't say if that could change.
Definitely with the Rogers Centre being right here, without a doubt, those are our big days.
Melissa McLennan is the manager at Pint Public House. She says they'll be watching closely because they count on the Jays to bring in huge crowds, particularly on promotional nights like Wednesday Wing Night.
Wednesdays when we have a Blue Jays home game, you're probably looking at $30,000, $40,000 a day, whereas last year, any given Wednesday, we're looking at, $5,000, $6,000.
The fact that the team is considered a playoff contender is only added incentive for fans to have the team back in the city.
Just not having the buzz, right? The buzz around the city.
I mean, I remember watching being in person for the Jose Bautista bat flip and the Edwin walk-off last time they made the playoffs. So it would be unbelievable if we could see that in person again.
It only leads to a positive chain of reactions for the city.
Greg Ross, CBC News, Toronto.
Mainly clear skies tonight, and you definitely needed your winter coat with the dipping temperatures. Currently -1, but feeling like -8 downtown. Let's go now to our meteorologist, Colette Kennedy, with a look at the forecast. And Colette, pretty chilly out there today. We knew it was coming, but thankfully it won't last too long.
Yeah, that's right. It is kind of, tonight's going to be one of the cooler nights, and tomorrow's still chilly. But you know what? We're going to get some sunshine coming for Good Friday as well. And the holiday weekend not looking too bad. So I'm going to walk you through all of that. But just know that not only the temperatures falling off, but keeping those north to northwesterly winds tonight. So tomorrow morning, those wind chills will be on the very chilly side. Then we get into that holiday weekend. It'll be kind of gradual, but we will see those temperatures coming on up. But today, 6 a.m., -2. There wasn't a big change with our temperatures, though. We warmed it up a few degrees, got above freezing. So 2 p.m., 2 degrees. That's the best we could do after some of those morning flurries. But clear skies tonight. There's the sunshine tomorrow, thanks to high pressure. And I will just mention that as we roll this forward and we look at Saturday, we will see some increasing cloudiness coming in. Now that starts to roll in. I think we'll start off with sun, and then it begins to push in and towards midday becoming mostly cloudy at times before that kind of pulse moves on through. So a slim chance of showers. We're going to keep that more to the north of us, however. The winds, yeah, those northwesterly winds, they are a little stubborn. So even tomorrow, we're going to be seeing at times those winds gusting in the afternoon to 30, 40 kilometers an hour. Your temperatures overnight in southwestern Ontario, -5 for Windsor. Your winds a little bit lighter. feeling like -8, a little more cloud cover there, and even some flurries. That risk towards Chatham-Kent, be aware of that. Sarnia as well. But tomorrow afternoon, there you go. High pressure is going to help that temperature come up to 8 degrees. You'll see that into Leamington as well. And around the Golden Horseshoe, these are the overnight temperatures. So I've put the wind chill up there, feeling like -11. That's with Toronto and at Pearson with a temperature of -5. Now Markham at -7, you're going to be feeling more like about -13 with your wind chill factor there. And tomorrow afternoon, it is going to be a nice day. Just keep in mind that those winds will be blowing a little bit still, and you'll also want your sunglasses for all that sunshine. A look at Saturday, there's how that temperature is coming up. So looking good on Saturday, 9 degrees with that extra cloud cover that I mentioned. And then as we look at Easter Sunday, there we go. We're getting ourselves back towards the teens, so 13 degrees for your daytime high. The other thing to take note of is that as we get into the holiday weekend, we'll see those overnight lows coming up above freezing. And then as we go into Monday, Tuesday, a pair of 11s there and a more significant chance of showers that's going to be moving back in for Tuesday, Kelda.
Thanks so much, Colette.
The weather is brought to you by Trane, the most reliable heating and cooling brand. We test, so it runs. It's hard to stop a train.
So neighbors, thank you for all of your help, and I give you Regal Heights Maple Syrup 2021.
When we come back, we head to St. Clair West to check in on a very Canadian yearly tradition. Stay with us. Finally tonight, it's a yearly tradition. A Toronto neighborhood along St. Clair West gets together to tap maple trees. Volunteers produce their own maple syrup and then share the sweet treat with the rest of the neighborhood. This year looked a little different, but more people at home meant more helping hands. And we joined in on the fun.
In order to make maple syrup, you have to have about 40 liters of sap to get 1 liter of syrup. This is I believe the 3rd year in a row that we've gotten together as a neighborhood to make our own maple syrup tapped from our own trees. We've got taps on 9 trees, about 12 or 13 taps on 9 trees throughout the neighborhood. And we've broken the job down into people who collect the stuff, collect the sap as it fills up the buckets, and then people who boil it down, partially to boil it down, ready to make into the final boil down for syrup.
Well, we have been going down to the maple trees, and there's these blue buckets that are connected to the trees where the sap comes out.
What's the hardest part?
Getting the bucket off the tree. We've been checking them every day and then seeing how full they are and pouring them into a much bigger bucket, and that bigger bucket is taken to be boiled. Well, it's just kind of fun because we get to go there and it's rewarding because by the end we're gonna get maple syrup, and maple syrup's good.
Yeah, I do my sap on my kitchen stove inside.
Won't be long now before we're done.
It looks pretty good. And to boil down one like this might take about 3 hours. You can tell when it's ready. When it hits 104 degrees, then you know it's syrup. The higher the sugar content, the higher the boiling point. Well, the finished product ends up in little 100 milliliter glass bottles just like this one, with a label that was designed by a neighbor down the street who's a graphic designer. And we give one of these to everybody who's involved. So neighbors, thank you for all of your help. And I give you Regal Heights Maple Syrup 2021. Cheers. Cheers. No, it's 100% pure Regal Heights maple syrup. That's the good stuff.
Delicious.
It tastes great. It really is. It's probably some of the best maple syrup in Canada.
That's our show for you tonight. Thank you so much for watching. Dwight Drummond has your next local newscast tomorrow at 6. I will see you back here tomorrow night at 11. Have a great night, everyone.